Dr. Doreen 𝗏𝗓𝗓 is the
Dr. Doreen is an expert in autism.
Doreen 𝗏𝗓𝗓.
Dr. 𝗏𝗓𝗓.
Dr. Doreen 𝗏𝗏𝗓𝗓.
Dr. Doreen 𝗏𝗏𝗓𝗓 is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
Muhammad has said that he's not able to work with his 3-year-old, almost 4-year-old son screaming, which comes very often during the day. He's in an inclusive school, taking ABA, OT, and speech sessions. Also want to know if half an hour of a speech session works. But he goes on to say that his son is verbal. And he wants to know, does a mild autistic child learn behaviors from other autistic kids in an inclusive school system? And this has sparked some controversy in the comments about, as it always does,
Right.
about, if we want to make sure that we're, autism and the symptoms of autism are not contagious.
Yes.
However, if anyone is sitting with someone and somebody is engaging in a behavior, sometimes we will take on that behavior.
Yes.
That happens sometimes.
Yes.
And that's not an indictment of the person who's on the spectrum who's engaging in that behavior. But I do think that as parents, we need to be mindful of that sometimes certain kids who are doing certain STEM things cannot be sat together.
Yes.
Let's say that. But as far as the screaming, because I know Muhammad had written in about that yesterday, that his son is screaming on a regular basis.
Yeah,
Shall we talk about that a little bit?
Yeah, it's so tough to deal with that. The other thing, I want to start by saying that a lot of parents think that their child is receiving ABA in school when actually that's kind of not happening. So, ABA is, when you're in a classroom, ABA generally has to be done 1-to-1 in the beginning. So I don't know how your child is receiving ABA. Check on that, Mohammed. First of all, is the child being taken from the classroom to an ABA session? Because a lot of times what's happening in a classroom isn't ABA, and we're just told that the child's receiving ABA. So ideally, if the child is receiving ABA, they should learn that screaming is not necessarily going to get them. First of all, let's start with, why are they screaming? So usually when a child screams, it's either because they're trying to gain access to something, or because they're trying to avoid something, or they could be doing it for a self-stimulatory type of reason, which means they like the sound and they're playing with the sound. So if you have a good ABA professional working with your child, they identify why that is. And what it sounds like to me, because you said something like you can't work with him screaming, which comes very often during the day. Now, I have seen kids who scream for stereotypy, like they're just doing it kind of as a game. They're walking around and going, ah, ah, like that, and they like to hear the sound. But most often when they're screaming, it's because the child has realized that if I scream, they leave me alone. So I don't want to do something, I will scream. I don't want to do something, I will hit. Those are the types of things that our kids learn. And you have to make sure that when the child, if that's the case, if they're screaming in order to get you to stop, you have to not stop. So it is important that everyone in his environment continues what they're doing when he's screaming, so that he learns the screaming is ineffective. Now that, what I'm telling you, is only if he screams, the screaming function, the reason he screams is because he's trying to avoid something or gain access to something. If he's screaming on a continual basis, even when he's alone, even when no one is placing any kind of demand on him, it could also be self-stimulatory. Identify that and then talk to me, because then I can help you with that. That's a whole different scenario. But I think it is definitely the case that kids will imitate what's going on around them, because kids are smart and they see someone else doing something. They might just be intrigued by it, or they might realize, oh, this kid gets to go outside every 5 minutes because he's screaming, so I'm going to do the same thing. So it is very important to have the right placement, why don't you do some observations and just see how your child's doing in the classroom? And that will give you some feedback as to whether they should be there.
Okay, I also want to say to Phoenix, I welcome you to the conversation, but I do want to say that it's really important. One of the things that you say here, Phoenix, is that all individuals who are on the spectrum are not identical, and we support that very heavily here on this show. But I also need for you to recognize, because you're writing some very black and white things about all ABA and about all people who are neurotypical and how we think about people who are on the spectrum. I would like to ask you to please leave room for the fact that a lot of people who are neurotypical want to be strong allies to people on the spectrum and respect their differences. It's not all of us. And all ABA, you say all ABA is intended to make autistic people appear not autistic. And I want to, suggest to you that there are different practitioners of ABA, and we're proponents here of good, conscious ABA that considers the individual, their sensory needs, and what they want to accomplish in their life.
Yeah.
That's about teaching them and is positive. So I hope we can keep that positive, because we welcome you to be here and be a part of the conversation. Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.